Thank you. Thank you, Yvonne, and good morning, everybody. I share Yvonne's excitement for actually being here face to face. It seems a bit sad to say, but been stuck in my bedroom presenting at events and conferences for far too long. That's something I never thought I'd say as a grown adult, and a grown man. But there you go. And I'd say there's always that patter about please do use the chat function, but clearly you can't use the chat function now. So anyway, putting that aside, it's great to be invited to be here with you today and to share this morning with yourselves. So as Yvonne has said, I'm the national lead for physical activity and healthy weight. Last time I spoke at a Y Sports event, not only was I in my bedroom, but I was part of Public Health England. Colleagues, including regions and place colleagues, and good to see Jackie in the audience today from London, have since moved to the Department for Health and Social Care and now in the Office for Health Improvement and Disparities. And so you're probably all thinking, well, what is that office meant to do? Well, it's pretty much as it says on the tin. We're using our scientific evidence that's come across from PHE and blending that with policy experience in the department to help improve the nation's health and obviously to try to tackle some of these disparities and inequalities in public health issues like obesity, poor diets and inactivity. And obviously that latter one is really important today. And OHID has published its responsibilities on gov.uk, and physical activity and the evidence and supporting implementation on the ground, which many of you will be involved in, I have no doubt, is critical to improving the nation's health. And when it comes to physical activity, I'm going to be reflecting on some of the functions that OHID and the physical activity team are leading on. And not least at the centre of all of that is how we move people towards the UK Chief Medical Officer Physical Activity Guidelines. And that is something that we hold very dear and share that responsibility for promoting and updating with UK health departments. So I just wanted to fix that in your heads. But we do that by influencing and working nationally across government with DfE, with the Department for Digital Culture, Media and Sport, but obviously also to enable work at a local level in the NHS and with local authorities and with the voluntary and community sector as well. So my task today, and I'm not using the mouse, is to give you an outline to set the platform for my fellow speakers who will no doubt add a lot more depth into specific activities that are ongoing to support parts of specific groups of the population, but obviously also specific programs of work to support and enable people to lead more active lives. So we all know that physical activity is a positive behaviour. If it was a commercial determinant of health, it would be something that we would be and are really promoting significantly. And we know that the benefits that can be derived from physical activity, and it is essential for the healthy development of all of us, and particularly children and young people, in terms of enabling them to grow up with healthy bones and healthy muscles, which will last, well, hopefully last a lifetime, and will be able to instill physical literacy at an early age that will also enable children to grow up. And we know that physical activity, there's the evidence that the Faculty of Sport and Exercise Medicine and Sport England and OHID and others help to curate and publish that for most people living with long-term conditions, being physically active is safer than not being active. And I know that's something that is really important, and how we support people living with long-term conditions is quite key going forward, because they're some of the people in the population with the most to benefit. We know that physical activity can help to maintain a healthy weight, and it's an integral part of a weight loss program. We need to change the calories that we're intaking and the foods. We need to eat healthier, but physical activity is an important component of a behavioural program to support weight loss. And so clearly physical activity and enabling people to lead active lives is part of what we need to do around supporting the nation to lead healthier lives and to address and prevent obesity. On the converse side, we know that inactivity has really negative impacts for health, and inactive lifestyles can increase the risk of many chronic diseases, some cancers, coronary heart disease, type 2 diabetes, but also the mental health aspects. And William's going to speak more about those aspects in due course. But as Yvonne said, there is a massive economic argument to invest in physical activity at a national and a local level. And I think the work that Sport England commissioned Sheffield Hallam University to do suggests that for every £1 spent on local physical activity and sport, you can recuperate £4 in social value. So that's quite a strong economic argument, and we need to use these health and economic arguments to make the case going forward. So I keep reaching for the mouse. See, this is my headset is still in my bedroom. Jamie, get a grip. So I think that we all know the state of the nation when it comes to levels of inactivity and physical activity. And I guess this slide from the Active Life Survey just really demonstrates the impact that the pandemic has had. Before the pandemic, we were seeing increases in physical activity in most population groups. And obviously the measures to suppress the virus were critical. I don't think we would argue the case. But clearly they had unintended consequences for people's opportunities to stay physically active. And yes, there were unintended consequences. You know, we all had that opportunity to get out during the first lockdown, and I'm sure that we all made use of that. And there was innovation within the sector and the system to enable people to stay active and to lead more healthier lives. But still, we're still seeing these sort of stubborn decreases in physical activity. And that's for adults and for children and young people as well. So there's a lot of work to do. But there are stark inequalities, and these inequalities and disparities in physical activity opportunities and levels in the population existed before the pandemic, and they've got worse, I think it's fair to say. I'm not going to go into this in any detail, but you can see the differences between, for instance, socioeconomic groups. You know, there's a 19% difference there, and in people, disabled people, and people living with long-term conditions, there's a 21% difference. And, you know, I'm aware the Activity Alliance published some new research that they're done with disabled people about the fact that disabled people, I think it's less than 3 in 10 disabled people feel encouraged to get back to being physically active since the pandemic. So I think that just reinforces the fact that there's a lot of work to do. And this represents adults, but if we looked at children and active lives, I think we'd see similar patterns for inequalities and disparities. And these are also patterned by geography, and no surprise, geography and levels of deprivation also intertwine as well. And I mean, these are quite complex maps, one for adults and one for children, but you can see that there's clusters in the northeast, the Midlands and the northwest, and Yorkshire and Humber and Lincolnshire, but also into Essex and Norfolk as well. I think I've got my geography right there, but you can hold me to account on that if you want. But I think the message I'm getting across here is that disparities are stubborn, they're persistent, and they're defined by geography, by population group, and by levels of deprivation. And obviously, we're all aware of the cost of living crisis and everything that's going on. And so we've got to have due consideration for these inequalities. You know, I embrace complexity. I've worked on obesity and healthy weight and now physical activity. And these are complex public health issues. There is no one single solution to tackling inactivity. This map by Harry Rutter and colleagues sort of demonstrates the interactions and the connection between some of these things that are driving inactivity, but are also opportunities to make a difference in people's lives and to change things, whether that's active travel, whether that's about green space, whether that's about what primary care and secondary care can do, and I'll reflect a bit more on that. But I wanted to sort of emphasise the fact that we know this is complex, but we need to keep the solution simple, and we need to work together. We need to collaborate. We need to break down organisational boundaries internally and intra-organisations to make a difference. I think we know that there are lots of issues when it comes to barriers that people face around not just sport, but being physically active. I've reflected on some of that. There's structural issues in the places where we live. We know that not everybody has equal access to leisure, to green space, to safe recreational space. And the wider determinants obviously play a massive factor in terms of how physically active people are. But nearer to me, we also know a lot about what works, whether that's through ISPA, whether that's through Everybody Active Every Day, and whether that's through WHO's work on the Global Action Plan. So it's not as though we're devoid of knowledge and evidence. It's about how we put that into practice for the long term. And I also wanted to quickly demonstrate and highlight that we need to be in this for the long haul. This is a life course approach. And like I said, if we start earlier on to build that health literacy and physical activity in people's lives, it is going to benefit them in later life. And I'm sure colleagues will reflect more on that over the course of the day. But at the same time, we have to consider who's going to most benefit from action at a national and local level. And we've got a big cohort of people who are currently inactive, whether that's aerobically or muscle strengthening, etc. And that's where there's potentially the highest impact for those people, is to move them from inactive to getting more active and working towards the UK CMO's guidelines, whether that's for disabled children and young people or adults or older adults. I think it's also, I've completely lost track of where I am in my notes. So if I start to sound a bit incoherent, please do hold me up. Now, as I said, systems thinking and systems mindset, I think, is key to this. There is no single solution. And I guess what I wanted to get across with this slide is that UK CMO's guidelines is at the centre of everything. PHE and OHID have invested in Everybody Active Every Day as an enabling framework for a systems approach to physical activity. But we've got to join up. I think that we know that across government we're working cohesively, but we can always do better working with DFE and DCMS. And there are a new sports strategy and a new school sport and activity action plan on the way, and we've got to coalesce and really knit those together. But we've also got Sport England's Uniting the Movement and implementation plan. So again, that's got to be in the picture and in frame. And this work nearest to me is learning from systems approach around obesity and healthy weight. And you can see, I don't think there's anything that's flagged on there that isn't applicable to what we need to do to tackle inactivity. We need leadership at all levels. We need to embrace the complexity, but not be befuddled by it. That's not an excuse for not doing anything. Yeah, things are complex, but there are opportunities to make a difference here, to benefit people's lives and to tackle disparities. And we need to do this. I'm quite clear on that. One of the things that we know that works for physical activity is enabling our healthcare professionals, but it's not just healthcare professionals, it has to be wider than that in terms of the health and social care workforce. And with Sport England and with other partners, PHE and now OHID, is still investing time and effort in the Moving Healthcare Professionals programme. This is a multi-work stream programme. We're in phase 2 of a programme, and we're learning lots from our partners, and essentially we're splitting. You could look at this in two themes. Well, there's 3 themes really. There's one that's about education, training, and resources. There's one that's about systems change, and the third one is evaluation. The thing that government always gets criticised for, maybe quite rightly, is evaluation and learning. And with Moving Healthcare Professionals, I'm quite proud to say that there is investment in evaluation, and we are recouping the learning throughout. And on a later slide, I will reflect on the process that's been taken towards this. But I'm just going to reflect a little bit on some of these assets that exist in the system. And there's a lot of credit to the Faculty of Sport and Exercise Medicine and people like William for supporting all of this work and active partnerships in terms of moving this forward. We've got a nationwide clinical champions who are there promoting physical activity to GPs, to medics, to allied health professionals, to midwives and nurses. And they're doing a great job in raising awareness within those professions of the the importance of physical activity. And they're supplemented by lots of e-learning that's available on HEE and BMJ websites. But the Moving Medicine consultation guides and the microsites that are being developed are also really pivotal in helping professionals to have those conversations with patients. And here are some emerging findings from the evaluation which suggest some really positive learning from the Clinical Champions Programme, but also from Moving Medicine. And so, you know, it's comforting to know that actually the investment in these resources and the work of the champions and everybody and Moving Medicine is really helping to shift things forward and enable health professionals to have these conversations that are important. So I'll let you just digest those findings for a little second, and clearly these slides are going to be available to you. But you know, evidence is crucial, and I just wanted to share very quickly some survey findings from an omnibus survey that PHE actually funded into understanding what, you know, GPs' knowledge and motivation and opportunities around physical activity. So this was published late in May. Hold my hands up, it was field work that was conducted in 21, in January 2021. So therefore it is a bit dated, but I still think that these findings are still applicable to where to today. They suggest that GPs are motivated to support their patients. There is awareness of the guidelines, but there are some key barriers in here in terms of time and perception of patients. But there's lots of facilitators here, and social prescribing and access to training and tools were some of them that were mentioned. I've got 2 minutes, so I'm going to motor through these now. Again, I wanted to flag very quickly research that we did with the University of West England into engaging NHS systems leaders. I don't think there's anything on here that will necessarily be a surprise to anybody. These are opportunities that we're now trying to put into place through some of the systems change work as part of the Moving Healthcare Professionals Programme. I know that Chris is going to talk to you a bit more about active hospitals later this afternoon, so I won't cover that, but that's really important work. And this is something that these trusts, building on what happened in Oxfordshire, are really living, and that's despite all the challenges of the pandemic. And this change diagram, you know, this plan, study, do type of mentality is what has been applied to the Moving Healthcare Professionals Programme throughout its development. But it's what is becoming really important when we're trying to tap into how do we change the system? How do we enable integrated care systems to embed physical activity within all their policies, prevention policies and treatment pathways? And it's really trying to get under the skin and understand how we can do that. I think we know that every integrated care system is different. How can we enable that with a uniform set of principles? And so we're working with NHS Horizons and with active partnerships and with other colleagues to co-develop, to co-think through this. And as you can see here, NHS Horizons have helped us to curate a hypothesis on how this needs to be done going forward. And this demonstrates some of that collaborative co-producing work that is really feeding in and making a difference to our thinking on this work. I can't emphasize the importance of that collaboration. The conversations themselves are making a difference. So the process is actually part of it, let alone the outputs. And I don't know what the outputs will be. As a civil servant, that could be quite uncomfortable for some people. But this is systems, this is complex, and I think that we need to be iterative in how we develop this. But OHID is doing lots of other things around physical activity. We have the Better Health campaign, which is helping people to get more active. We've got a Better Health Rewards pilot in Wolverhampton that's kicking off, and hopefully later on in the year we'll be publishing a Health Disparities white paper. I just want to summarise some really important points, but I want to emphasise the fact that we have to be in this for the long haul. Shiny interventions, you know, whatever that is, and you can say, Jamie, what is a shiny intervention? Is important, but it's not going to solve inactivity. only working together in a systems approach with a systems mindset is going to solve inactivity. And, you know, I want to be clear on that. And that's what we have to challenge ourselves on. The drivers of inactivity, they don't affect everybody equally. So they have a disproportionate impact on our most deprived areas, on disabled people, on older adults, and on people who are not white, basically. That's not good enough in this day and age, and we need to do something about it. We need systemic and progressive changes, and that can bring win-wins for the economy, for people, for places and communities. And it needs to be connected, and we need to challenge ourselves to connect and align things. We need cross-sector leadership. We're not going to get everything right straight away. I think we need to be safe in the knowledge that that's the case. But we have lots of assets and opportunities, not least everybody in this room, and all the wealth of knowledge and experience and practice and endeavour that you bring, and the motivation. You know, and enabling active lives is everybody's business. Now, I look forward to where we can move this as a collective, because I think that's what we need to do. And in the future, I hope to be able to look forward to coming back in some forum to share and celebrate with you and discuss further the learning and the evaluation from the Moving Healthcare Professionals programme. And I just thank you for listening, and I'm sorry if I overran.